Let's start 2025 with a smile. Whether you're ready for a confidence boost or finally tackling those long-awaited dental goals, make this the year to prioritize you. This morning, we'll discuss one-piece implants and how they're helping people smile bigger, brighter, and bolder. Let's welcome Dr. Andrea Joy Smith from Smile Again Now. Hello, Dr. Smith.
Good morning, Desiree. How are you this morning?
I'm doing good. How are you?
I'm doing great.
Good. Well, we're starting off right. And Dr. Andrea, let's talk bold transformations with you. How can a smile makeover help someone truly step into their best self this year?
Absolutely. When patients walk around with smiles that they're less than proud of, they often cover their mouths, and after COVID-19, they would just wear a mask. But once they have a great smile makeover transformation, they remove the mask, they smile with confidence, and they step back into their lives as the persons they are that they know themselves to be. A lot of times they say, I am me again, because they had stopped smiling. They've been wearing masks, and when they see their teeth for the first time, they often cry.
Yes. And I mean, before they get that smile that they've been waiting for, there's some hesitancy there. So why is it that some patients delay their dental treatment until issues worsen, Dr. Smith?
I think one of the number one reasons that patients delay their treatment is because of dental fear. I have a lot of patients that suffer from dental anxiety, and so in my office, we provide sedation dentistry to help allay their fears. We get them in, we do the treatment, they wake up at home and they wonder if they even had a visit that day.
Yep.
So if we can overcome that fear, that is the biggest thing that's keeping them away. Another issue is also finances too, as we know that all dental treatment, not just dental implants, can be very expensive. And these patients, we're budget conscious, and they have to find something that fits within their budget.
How else would you say you and your team make this process more achievable in 2025?
Yes, in 2025, we're actually almost the same as 2024. When that patient walks into our door, we meet them right where they are. And long before I even look inside their mouths, I sit down and have an eye to eye conversation with them. And actually, on the phone call, my team has made them feel comfortable enough to walk into the office. Because believe it or not, just walking into a dental office after staying away for so long is very anxiety producing. And so my team does a good job of getting them in. And once I have them in my chair, long before I look in their mouths, I get to know them. I look them eye to eye. They tell me what their concerns are. A lot of times they've been judged or prejudged by other practitioners.
Yeah.
And so I try my best to just meet them where they are, look at what they have, and get them back on the right track.
I'm sure that can definitely help ease those nerves. So let's talk about one-piece implants. Who makes a good candidate for that?
Actually, believe it or not, just about most people are good candidates for it. These implants have several different names. We used to call them mini dental implants, and those were the ones for patients that didn't have a lot of bone, but we could stabilize dentures and even do a single tooth. Now we have larger diameter one piece implants that make them more acceptable to the rest of the mouth. And for that population that also has more bone, we put in a larger one piece implant. But what makes the surgery so much better is that it is a one stage surgery. With conventional implants, although they work very well and they have done a great service to the dental community for a very long time, oftentimes patients are not healthy enough. They may have some medical compromises that might prevent them from having the more extensive bone grafting, two-stage surgery, and things of that nature. So the one-piece implant paradigm actually lets us do it in one surgery. We load it, or we put the restoration on the same day, and patients are a lot happier. And the process is a lot more minimally invasive as well.
Ooh, okay, so tell us about that process. Briefly walk us through the process and how one-piece implants are installed.
Okay. Well, basically, most dental surgeries begin with taking the gums apart so that they can access the bone. But with the one piece dental implants, we insert the implant directly through the tissue, of course, after getting the patient numb. But what that does is it keeps that blood supply attached. That allows the healing time to be a lot faster because the tissue does not have to regrow into the bone. We remove less bone because we're doing a less invasive procedure. That cuts down on healing time. It also cuts down on pain after the procedure. We call it post-operative pain.
And Dr. Smith, you have been educating our viewers about one-piece implants for years now, but we have not shared the cost of treatment. For viewers who want to know about the cost, what can you tell them?
Well, of course, without seeing them personally, there are guidelines that we can follow. For instance, the one piece implants, because it is a simpler surgery, a one stage surgery, and the implants are less complicated, I can actually say that the one piece dental implant is about half the cost of the conventional implant. And we know that conventional implants can be very expensive just for one. But for small diameter or one piece implants, we can actually restore their smile for about half the cost.
Oh, wow. Okay, so once they agree to that cost and they've gotten their one implant procedure done, following the procedure,
Mhm.
how does somebody maintain their implants at home, Dr. Smith?
Yeah, just like with your normal teeth, you need to see the dentist often, at least every 6 months. And so, if we have used those one piece implants to stabilize dentures, there's these little O rings that are in there that need to be changed. If we have used the implants to fix an appliance, they need to come in for regular cleanings. And so, at home, though, we have them brushed normally. We use floss threaders. We also have them use water picks. So there's a lot of ways for them to maintain at home, and then they must see us every 6 months to make sure that everything is still working well.
All right, well, we got a testimonial from one of your patients, Dr. Smith, so let's give a listen to see how their process went.
I just want to thank Dr. Andrea Joy Smith for giving me my smile. I have not had nice teeth or a straight smile since I probably was in third, fourth, fifth grade. I was so self-conscious about my teeth. But because of her treatment and her procedures, I now can smile. I'm proud of myself, and I encourage anybody to overcome your fears and come and see her and put your life back on track as it pertains to your dentistry.
We heard from the patients themselves. We heard from you, Dr. Smith, as well. Always a pleasure getting to learn more and more about how we can perfect our smile. And to our viewers, you can smile bright this year and learn more by going to smileagainnow.com.